Where is it? Shengbo?
No. Maybe I could say so. Okay, well, can you mention? Okay, I don't know. What about the pastor? Wow. Oh, God.
Was it blessing sorry? Yeah, Hobby.
Hello, everyone.
Okay.
Everyone.
What's up?
Good evening, everyone. Sorry I'm late for this class.
I think bye.
I'm trying to set
But Samuel, me, Bomo. Samuel. And don't show you what I'm saying.
I want the host.
Okay. Don't worry. We are starting the class very soon. I'm trying to set my system here so we can get started. All right. Okay. Two. Gosh, why are you? Okay. Once again, good evening, everyone. We are welcome to week 5 of our live class session of NSC 508. We are on module 3, and while I'm waiting for the system to get set, I want to appreciate those of us that we are present this evening. And again, I want to also say I'm deeply sorry for starting the class late. It's not my intention. The circumstances was beyond me, but at least I'm happy that I'm able to come online to do the facilitation. And so we are getting started now, though we are behind time, but we'll see how far we can go with the few minutes that we have. So before we start, for those of us that we are present, how many of us I've been able to go through today's lesson. If you are on class, if you are available and you are able to go through today's materials, I mean Unit 4, Unit 3 and Unit 4 of today's class, can you type yes on the chat? Can you just type yes on the chat if you manage to go through the lesson that we will be going through today, which is Module 4, Unit 3 and Unit 4. And like like I said, we are still on Module 3, and we'll be rounding up Module 3 today. And the title for Unit 3 is Nursing Aspect of Health Informatics. The title for Module 3, Unit 3 is Nursing Aspect of Nursing Informatics. And I'm going to quickly share the learning goal for today's study. And for those of us that we are available on this class session, I would encourage us to put on our video since class is in session. It is important that I see the student that I'm facilitating. Thank you as you comply. So let me quickly share my screen on the learning goal for the unit we are going to, the 2 units we are looking at today. The learning goal says, at the end of today's class, learners should be able to discuss nursing information system, explain sources of data capture, list types of points of care devices, explain standardized nursing terminologies, describe the approaches to nursing terminologies, and lastly, students should be able to discuss nursing terminologies. So at the end of today's facilitation or at the end of today's class session, learners should be able to explain the following learning goals. And so quickly we are starting with Unit 3, which is titled Nursing Aspects of Health Informatics System. What is it all about? As you can see on the screen that I'm sharing with you, you see a nurse by the right-hand side with a laptop and a bold letter on it, written Nursing Informatics. And Nursing Information System is a part of healthcare information system that deals with nursing aspects, particularly the maintenance of the nursing record. The several objectives that our nursing information system should meet in order to succeed its aim, cover the user's needs, and operate properly are described here. We are looking at the nursing information system. We are looking at nursing information system, and for those of us that we are at home, please kindly remember that this is class session. I've unmuted everyone, but it seems that I still hear some background noise. Please, let's try to pay attention that this class is being recorded, so any undue background noise will interfere. Thank you so much. So, as I was saying that nursing information system, it's important in nursing for record purposes, and not only for record purposes, We also see that it also helps us to organize information, data, and knowledge from the Clara, please, why stop unmuting yourself, please. I unmuted you. I muted you and you unmuted yourself. Please, you are disturbing my class. Please, or else I will log you out of the class. Please. Sorry for that interruption. So I continue with Unit 3 that says 3 categories. We have 3 categories of nursing activities under this unit, and we said the 3 categories are the managerial roles or coordinating activities, the physician delegated tasks, autonomous nursing function. These are the 3 main categories of nursing activities. And how can technology help nurses care for patients? We have been talking about technology under these courses, the use of technology, the importance of data, the importance of information, and the importance of knowledge. But we want to look at how this information helps in our nursing care to our patients. First, we said the use of computer and information technology to support an electronic health record is quickly becoming a standard practice in healthcare. For nurses and other healthcare team members, the use of computer technology provides quick access to important information about the patient's health or illnesses. Okay, Chuku, Inena, please. I just muted you. Please don't unmute yourself. None of you should unmute yourself. It affects the flow of the class. Okay, please. Thank you. All right, so as I was saying that we have three categories of nursing activities, which are the managerial role, the nurse, the physician delegated activities, and the autonomy role of the nurses. And so these 3 I just mentioned, and we also look at how can this help, how can it help nurses care for patients. And we just mentioned that technology, the use of technology in health services or in healthcare system is becoming a standard of practice. It's not a news. It's becoming a standard of practice globally. And nurses globally are key into using technology in nursing care for patients. So we also looked at, we also looked at other aspects in this. We've just mentioned how nurses, how technology helps nurses for patients. We move to the next point, which is how nurses use computers in their daily work. How do we use computer or technology in our nursing routine? 1, for record purposes. Record on the electronic health record, the patient's personal healthcare story. The treatment nurses carried out for patients and the response, as well as the progress towards the healthcare goal of the patient. while monitoring, as well as for the ready access by other class members. Obtain information about the patient.
Nobody make a whole head down. Of course, ma.
Oh my word. Please stop unmuting yourself. You are interrupting my class, please. And so, as I was saying, that the following are the ways nurses use computers in daily work: to review data about the patient's current and past health situation, as well as plan of care on the electronic health record. Assess clinical knowledge such as drug information, nursing assessment, articles, and so on and so forth. Also assess clinical knowledge to provide information management assistance to patients. What are the source data capture? Source data capture means gathering data and information about patients where it originates, that is, with the patient locating it at the point of care. It's a valid premise, and clinicians appears to favor the bedside terminal as a means to reduce much of the clerical workload and improve access to the data. We also have criteria for source data capture. What do we mean by criteria for source data capture? It must permit nurses at the patient's bedside to interact with the main patient database and the main care planning. That is, this source of data capture must permit nurses, whether the patient bedside, to interact and also key in the information, that is the database. It must also have the capacity to interact with existing hospital information system, so that effort already expanded in developing hospital information is not wasted. Such technology must be small and compact so as to occupy the minimum amount of space. So you will see that is a device that is used, and it allows nurses, or flexibility of nurses to use it while caring for the patient. The technology must be easy and uncomplicated. So the technologies we use in nursing, in patient care, it's easy and it's not complicated at all. The provision made available variety of means of data entry. You see that they've so developed it in such a way that it allows multiple data entry. And this technology allows nurses the maximum degree of mobility, irrespective of the unit or where your patient is being transferred to. This device or this technology allows for the flexibility of it. What are the types of point of care devices? We have standard stationary terminal, we have specially designed terminal, and we also have handheld portable terminal. Uses of source data capture in healthcare. Nurses document their work and outcome for a number of reasons. We look at those number of reasons. Majorly, it's for communication purposes. You want to communicate the care you have given to your patients to other healthcare team members, so that when you are there, other healthcare members or team can know what has been done for this patient, and then they can carry it on with their own duty or their own care for the patient. Also for regulatory and legislative purposes, for research purposes, as well as for quality activities. A number of factors such as increasing prevalences of infectious disease in developing countries, also as well as lifestyle diseases, also is being put into consideration for record purposes. Nursing data standard. Nursing standards in the development and implementation of electronic health record. It's for effectiveness purpose of delivery nursing services. We also have nurses continually using mental processes. We generate a lot of information, and we also use that information. So far, before I continue, let me see if what we've covered so far is clear, or you will need some clarification. For those of us that we are live in the class is still in session. What we've said so far, or what we've discussed so far, are we cool with it? Is it clear? Are there questions or areas that you will need me to explain? Don't worry, because the class started a bit late. We might not end exactly at 6 today. I will give additional time. But if you have things to do and you feel that you cannot continue after 6, you are permitted to be excused. Questions and contribution. Okay, uses of source data capture. What is it? What's your question on that? Another important information, like I always say every week, is that earlier before this class session, PowerPoint instructional video has been posted on the VLE page. It's more explanatory, it's more detailed. So I will also encourage you to go to the VLE page, download it and go through it. And so if you have any question after you have gone through the PowerPoint instructional video, I think you can bring your question in our next class, because if you have not gone through it and you are expecting to grab everything within this 1 hour of class session, I think you are not being fair to yourself. So let me advise that you download the PowerPoint instructional video, go through it, then whatever question you have, write it down and present it in our next class session. It will be well dealt with. So let's continue with the class. I shared my screen on the points of decision support system. What do we mean by decision support system? It's simply a computer-based form of decision tools, integrating information with the characteristics of individual patients to provide advice to clinicians. We also have clinical decision support used interchangeably with DCC, has been shown to lead to significant quality and safety improvement in patient care and improve workflow among clinicians. Nurses have a unique dual role regarding information. Like I mentioned earlier, that we generate and we also consume that information we generate in so many ways. And so decision clinical decision support system have the potential to deliver improved quality of care, increase clinician evidence, improve documentation, and patient satisfaction. So we've seen the importance of clinician decision support system. And we want to quickly look at the 6 major uses of decision support system. What are they? We have alerting. What do we mean by alerting? That is the system, this technology is built to alert nurses on patient attention. We have interpretation. Interpretation is also another major decision support. We have assisting. What do we mean by assisting? The explanation are there. I still encourage you to go on the the instructional PowerPoint posted earlier on the page. You would get the details explanation. We have critiquing. We also have diagnosing and managing. So far, those are the 6. Those are the 6 uses of decision support system: alerting, interpretation, critiquing, diagnosing, managing, and assisting. So that is the few slides that we are going to cover under unit 3 of module 3. And so far, I want to ask for your contribution. Okay, for those of us that what you just simply do, once you get to the VLE, I'm seeing some comments here being posted that they are not able to download the instructional video on the VLE. What you just do, once you get to the VLE page, go to Fundamental of Nursing Informatics and check on the week. If you want to download the instructional video on week 1, you will see week 1, under unit 1, you will see instructional video. Just click on that file. You see a purple, a deep and light purple file signal there. Just click on it. Once you click on it, it will download automatically. So try again. Just click on it. On a weekly basis, it's posted. Just click on the file. It will download itself. I hope I've been able to answer your question. Any contribution on unit 3 of module 3 that we just finished? All right, let's have a 2-minute quiz. For those of us that we are live on the chat, can you type in the 6 uses of decision support system? Like I always say, every week, every activity has a reward. And each time I post assignment or quiz during the class session, there is a reward for it. So I'm informing you so that you can make an informed decision whether you want to participate or not. So the 6 uses of decision-making, decision support system that we just covered now, can you type it on the chat so that I know that we understood what we've just covered so far? That is the first quiz. Then the second question or the second quiz is mention the 3 managerial, the 3 roles of nursing. I just mentioned one. What are the 3 categories of nurses' activities? I just mentioned it. The managerial, the physician, delegated, and the autonomous. I've even given you open quiz. So I'm expecting to see it on the chat while I'm waiting for you to type and send your answers to the quiz. Okay, alerting. Okay, Janet, thank you. Alerting, interpretation, assisting, critiquing, diagnosing, and managing. Excellent. All right. All right. I am. Hopefully, others also will send theirs. All right. And the second quiz is the 3 categories of nursing activities. All right, let's quickly go to Unit 4 of Module 3. Unit 4 of Module 3, which is titled Standardized Nursing Terminologies. Standardized nursing terminologies. Nursing terminologies and vocabulary structures was first developed in 1973, and many have changed significantly since their inceptions. Of course, since 1973 up to now is a long time, and so a lot of terminologies have changed, some have been rephrased. Realizing that the standardization of nursing care documentation was a critical component, in nursing, American Nursing Association in 1989 created a process to recognize languages, vocabularies, and terminology in nursing practice. However, there is inability to ensure availability of shareable and comparable nursing data in nursing generally. And so the high quality nursing data can assist in the optimal integration of registered nurses into high value, lower cost, and approaches to longitudinal care. What are the 7 recognized terminologies designed specifically for the use for nurses? In nursing, specifically, we have 7 recognized terminologies, and we are going to quickly look at those 7. One is clinical care classification. We have clinical care classification. We have international classification of nursing practice. We have North American Nursing Diagnosis Association International. We also have nursing intervention classification, and we have nursing outcomes classification. And we also have mass system and perioperative nursing data sets. And so, logical observation identifier, name, and code. So I've just mentioned to you now the 6 categories, or the six recognized terminologies that is designed for nursing. We've just looked at the 6, and quickly I want to unpack logical observation identifier, names, and codes. What do we mean by that? Although originally logical observation identifier, names, and code was designed for laboratory assessment alone, but we've seen that this measure has included vital signs assessment from standardized nursing terminology. And so we've seen that logical observation identifier, names, and codes now is being used to measure or for vital signs assessment and terminology used in nursing. We also have minimum data set. What do we mean by minimum data set? The general concept of uniformed minimal health data sets can be defined as a minimum set of items of information with uniform definitions and categories concerning a specific aspect or dimension of the healthcare system, which meet the essential needs of multiple data users. Typically, it is organized around a specific type of data in order to support data sharing. And so, in other words, we have American Nursing Association recognized two main minimal data sets. And what are they? We have the nursing minimal data set and we have the nursing management data set. So far, those are the two data sets that American Nursing Association have recognized, and that is what we are so far. Okay. So what is nursing minimal data sets? Okay. Before we unpack, thanks for those of us that have responded to the quiz or answer the quiz. I can see managerial, physician, delegated task, and autonomous. Thank you so much. So we looked at the nursing minimal data sets. What do we mean by nursing minimal data set? It's simply, what do we mean by minimal nursing minimal data sets? Is a set of elements developed consistent with the general concept of a uniformed health data set, specifically intended for the collection of essentials, nursing care, which includes 16 items organized into categories of nursing care. And we have diagnosis, interventions, outcomes, and intensity of nursing care, patient demographic and service elements such as facility identifier, nurse identifier, admission and discharge dates. The element of nursing minimal data set can be used as a framework by other nursing terminologies, such as we are all familiar with NANDA. We are also familiar with NIC as well as NOC. So we've just looked at nursing minimal data set. We're moving now to nursing management minimal data set, which is also a uniform minimal health data set that specifically identifies variables essential to nursing. It was developed to provide a framework for the data needs of nurses, and it is used for administration purpose to measure the quality of healthcare services. And so we have approaches to nursing terminologies. And what are the approaches? It's simply used significantly over the past several decades in line with past practices in terminology work. From simple list of words or frames to large, complex so-called ontologies, that is the description of entities within a domain and the relationship between them. So when you hear ontology, it's just a description of entities within a domain. We also look at the enumerative approach. We've just looked at the approach, approaches to nursing terminology. Now we look at the enumerative approach, which is a list of simple hierarchy in terms of, in NANDA, for instance, now, we have nurses diagnosis that is associated with name or label or textual divination. but we also understand the flexibility of using our NANDA. It's very flexible in the sense that it has a multi-axial taxonomy which organizes nurses' diagnosis, and it makes no attempt to organize nursing diagnosis among themselves, but rather it just helps us to see how the relationship among NANDA nursing diagnosis work. And so we'd look at ontological approach. We've just looked at 3 approaches now, and the last one is the ontological approach, which is compositional in nature and a partial representation of the entity within a domain, which I've earlier mentioned. And we have the ICNP, we also have the NANDA, and all these described as a unified nursing language system to seek to provide the resources that can be used to develop local terminologies to facilitate a cross mapping between terminologies in order to compare and combine data in different sources. And so that is where we are going to end it today. I'm seeing a question on the chat. Please, ma, our course material said 7 recognized terminologies category. Other ones, what are they? Interdisciplinary terminologies and others. Okay, if you looked at it, I said, what I also said in this class session, it's 7. I mentioned 7 to you. So, and I just itemized them in the interest of time. Like I always say that 1 hour is not enough. And that is the reason why PowerPoint instructional video has been provided earlier to details it. In it, it's well explained, it's more detailed. So please, I will advise that you go through the PowerPoint instructional video. It's there in more details. And like I mentioned in this class session too, it is 7. Maybe you come late, maybe you came to the class late. Otherwise, it was mentioned under unit 3. That was covered under unit 3. Under unit 3, yes, terminology, 7 terminologies. So please go through the instructional PowerPoint video. It's more details there. Okay, so we've looked at these terminologies. We've looked at these terminologies and okay. So are there questions? Question? Excuse me. Any question? In conclusion, the majority of the commonly reported standardized nursing vocabularies take the form of taxonomic vocabularies. Examples include the North American Nursing Diagnosis Association taxonomy, the Nursing Intervention classification, the Home Health Care classification, and the UMAR community system. These representations are seen as important because they provide a structure for retrieving and using nursing data for automated system. So I want to say thank you for those of us that managed to come online for the class, and once again, I'm sorry for for starting the class late, but I'm happy that we are able to cover what we set out to cover today. Please, ma, today was my first time of joining. Please, ma, how do I download this class? The PowerPoint instructional video is on the VLE, like I mentioned, and this class session also is posted on the YouTube, and the link is also available on the VLE. Just click on it and it will download itself. Once you get to the VLE page, just click on unit. We are on week 5 now. Go to week 5. You will see PowerPoint instructional video. Click on the purple color file on it. Just click on it. It will download itself. And when you want to download the class session also, just click on the link. Then it will download itself. That is where we are going to leave it for today. And I want to welcome questions and contribution. And if there is none, I want to say thank you once again for joining the class session. For those of us that are present, we'll meet same time, same day, next week, by God's grace. Also, your assignment. For those of us that are available, please, when you are sending your assignments on the page, please convert your Word document to PDF. It's challenging for me because when you send the document as a Word document, I'll have to download it first before I can mark it. So it's a bit tedious. So please send your assignments using PDF. When you are done with it, convert it to PDF, then you can upload it. Thank you very much. I can see only 8 out of 1,000 students have responded to the assignment. I've extended the dates because the number of those of us that have done the assignment so far is not encouraging. Please, before I close the date, endeavor to do your assignment. Like I always say, your final exam is not sufficient. Please, all these quizzes, assignments, and attendance and class participations also will hand you some mark, which will boost your final exam. And I always say there is no how you will attend class, the class session. You will download the materials, you will listen to the instructional video, that you will fail the exam. It's not possible. It's not possible. Because there's no how you will not remember one way or the other the question, because you are not going to be examining outside of what we are discussing. In the exam, what you are going to see in an exam is just what we have been discussing. And so it is not my desire that any of the students should fail. But then you can only help me to help you. If you don't do your assignment, if you don't respond to, if you don't do the quiz, if you don't attend the class session, if you don't listen to the instructional video, how are you going to know? And how are you going to be able to defend yourself in the exam? So please, the essence of all these rigorous activities that we are putting in is to help students, is to reduce the massive failure, to ensure that all the students at least pass. I don't derive joy in seeing any student fail. So please do your part. And once your part is done, be sure that God will take care of the rest. Thank you so much once again for attending the class session. I appreciate, and by God's grace, we meet next week, Thursday, 5 to 6. Enjoy your evening. Bye. Ma, I just joined the class today. I didn't know the assignment. Check on the VLE page. Assignment is posted there. Even this week's assignment will be posted there. I've not posted last week own, but I will post it. I will do everything today. Check the assignment week by week as assignment. Check it, do your assignment, and post it back. It's being graded. Thank you. All right. Bye.